afternoon, everybody. It's me again, Kara, and I'm at the Oliver Animal Hospital right now, and I'm really excited to be with Brittany, and Dr. Orange is around the corner, and we're going to be talking a little bit about some of the diagnostic testing that we do with the animals that is less invasive and allows us to see what's going on inside the animal without having to do a surgery first. So I'm going to turn it over to Brittany, and she's going to give us some extraordinary knowledge.
So today we're going to kind of talk about the radiology that we do here at the zoo, or some people might call it X-rays, both works. We just call it radiology. So when we do radiographs at the zoo, we're looking internally at an animal. So a lot of the times you can kind of look at an animal and see if it has an injury, but until you get a radiograph and see what's going on in the bone or in the muscle or just anywhere around, you don't really know how severe an injury is. So today I'll just kind of talk to you a little bit about what we use when we do radiographs here. We have a wonderful education volunteer for some radiographs today, and then we'll just kind of go from there. So in here, if you come in here, I have set up just a few things that we use maybe on a daily basis to help us get the best pictures possible. Some of this stuff might not look what you would think would be used in a veterinary setting, but it has become very handy for us. So first off, we have Play-Doh, so every kid's favorite toy, and that can be used for a few different things. It has been used to stuff into the hooves of animals to negate some dead space that's in their hooves when we take radiographs. And it's also an excellent turtle restraint device, and I will demonstrate with 3D here in a few minutes.
Can you tell us what dead space is?
Oh, so dead space, it's kind of when you look at a radiograph, you have your two colors. You have your white and your black. So the dead space kind of, if you want to help.
It's just open space.
Yeah, it's just open space. So it shows up a bit darker. So the Play-Doh, when you shove it in there, it kind of clears that away so we can get a view of what we're looking at a little bit better. So then we also have painter's tape, so what you would use when you paint your living room. And this we use for when a bird is under anesthesia and we need to get him flat on a plate, so our X-ray plates. We actually use the tape to tape down their wings and tape down their feet. So it's painter's tape, so it's not very sticky, so when we go to pull it off, their feathers stay on them and don't come on our tape. So it's very painless for the birds, and they're asleep when we do it. We also have your run-of-the-mill cardboard box that we have affectionately written turtle and frog restraint on. So this is used when we have awake patients, like a turtle or a frog, to give them a barrier so they don't try to run off our plate and go out of the view.
And you guys have been using that same box for a while.
We have been using this same box for a while. It's a very old box, and you can see it. Some people have done math on it, and then we had to write keep on it so nobody would throw it away because we're very attached to this piece of cardboard. But then Dr. Wilson's husband actually made us a fancier, bigger box out of like plexiglass. So it's a bit sturdier and it has a clear front. So when we're looking and taking the X-ray, we can actually see the animal through it. Whereas here, we can't see the animal anymore because it's opaque. So that's kind of some of the stuff we use. So we have, in the last few years, gone to the digital side of radiographs. But I don't know how many people remember if you ever had to have a radiograph taken of your pet or of yourself. You went to your office and you have these hard plates that you would take radiographs in. And they have film in them, and then, so they have to take the radiograph, they would take it to be developed, so just like you would take a picture. They would develop it, and then have to see how good that picture came out. So sometimes when you were out in the zoo, had to take one of these with you, you had to bring it all the way back to the hospital, develop it, look at it, and then tell whoever's taking the radiographs, sorry, not good enough. So let's try again. And in a minute we'll go over kind of how we do it now. But I do have some old films to show you of when we used to do it that way. So we'll go into surgery with our light box. So I have just a couple pictures to show you. This is one we took of a flamingo. So its neck and its head, and you can see its nice beak there and it's filtering. Another disadvantage of film radiographs was they get splotches on them and they are very fragile. So they get holes in them and they've got speckles because depending on how clean your solution was, they get kind of all these artifacts.
And a speckle could be the difference between healthy and not healthy if you can't determine what the speckle is from.
Yes. Yes, so when we look at the speckles on here, like none of these are really over the bird, but we do have a couple little spots like here and here and all on the skull, so we would have to determine if that is an artifact, so something that shouldn't be there that we see, or if it's actually something within the animal and could be damaging. And this is actually a really good one because you can see the neck, the bones, and then also their trachea. So where they would breathe through. And birds are unique in that their trachea has closed rings, so it's not quite as flexible as humans. So there's our flamingo. So this is a prairie dog. So I got artsy and took two different views of it. You can see the teeth up here and then the teeth here. And this is a younger one. And you can see when you're taking the pictures how the other one was a little bit lighter and this one is kind of dark. That's also something you have to be aware of when you're doing film, because your film could come out extremely dark and you wouldn't be able to see all the very fine details that you would with a digital X-ray. So, and this one again is very dark, but it is a coiled snake. So you've got your head here, and it's coiled all along here. So, oh, and the lights are off, so that makes it a little bit easier to see. Usually you would look at these in a dark area. So you can see in our technique, which is how the power that we give our X-rays and everything. So the technique of your picture determines how dark or light it comes out. So you have your darker and then your lighter colors on your bones. So we'll do one more, and then we will get greedy in here, so we can do Greedy's radiographs. So here we have a bullfrog, and this was not a healthy bullfrog, so this isn't how they would normally look. It's a little bloated in here, but you can see all of the appendages and everything like that. And this X-ray too has become a little bit damaged. And that's mostly because this was just for testing and not so much to be kept as a preservation. We used to, with all of our films that we had stored up from years and years, we had them digitized so that we don't have to keep these films around anymore. And the films can get donated and they actually take the silver off of the films and they recycle it because you have to have silver when they develop. So, we can talk about how we go out to the zoo real quick. So I told you when you had your cassette, you would get your pictures, bring it back, develop it, and see how they were doing. Well, we don't have to do that anymore. So when we go into the field, this is our new VetRocket digital system. We have our bigger screen that stays here, but this is called our rover. So no bigger than an iPad. It's the same image. So then you just grab this with you. So you still have your images on here. And you would take this piece and a portable X-ray unit, or we call the mid-X-ray. This you would take out into the field, so you have your plate, where you actually put your animal on top of, and then you have to hold this. It's like 20 pounds, so it's not light, but we've gotten very good upper body strength from having to hold this thing up over animals. So you would hold it up above the animal, turn your light on, shoot your picture, and it would come up on this right away. So we can see what's wrong with that animal that minute and see if we need a different view. So we're going to demonstrate the quickness of our new radiograph system right now for you. So I will turn my mic over to Dr. Arns, and she can kind of go through the vet's part of this. So usually the technicians are the ones snapping the radiographs, and then we hand it off to the vets because they know way more than we do when it comes to actually looking at them.
Are you going to take a radiograph? Or?
Yeah. I'll get it set up for you. That's my job.
Thank you.
Greedy, on a regular exam, we noted that she had some eggs, which is fine for a turtle, but we weren't sure how long she had the eggs and whether or not they were stuck in her. So we decided to monitor her. She had no other signs on her health exam that she was in distress or uncomfortable, so we decided to just take it one day at a time and monitor to see if those eggs would, she would pass those eggs eventually. So we are going to use our turtle. Are you going to?
I'm going to put her in there, but I just wanted to show.
Oh, okay. Yes.
When we mentioned turtle restraint device.
So one way to get a good radiograph of a turtle is to put them here and to put the plate behind them. And so you would take the X-ray basically at this angle, and you'd be able to see the whole turtle. So the Play-Doh doubles as has multiple uses. So we're going to take a radiograph of her and see if we can see any eggs that are still inside of her, and then go from there.
And you notice there's a little dancing going on. We all have to exit the room when the radiograph comes on just to avoid any unnecessary exposure to ourselves.
And if we do have to be in the room with the animals, some animals we do, then we do have proper gowns, equipment that will shield us from the radiation.
And those are lead lined, is that correct? They're
Actually,
very
the ones that
heavy.
we have are different. They're barium infused, so lead lined is one way, but they're super, super heavy because we travel a lot throughout the zoo. We got these new barium ones, and so it's a liquid and they're much lighter and much more versatile.
Ready?
Ready. So it's okay that Greedy moves a little bit. Turtles are kind of slow, so it shouldn't mess up the radiograph too much. So she moved a little bit, but we still have a really good view of her. And it looks like there are no eggs inside of her, so that's pretty fantastic. So she must have passed the eggs without any trouble. And we can go and look at the radiograph that was before.
So there's a lot of compare and contrast with this technology. You have a baseline and then you compare to your baseline.
Yeah, so a lot of animals that we are doing exams on in the zoo, whether they're healthy or sick, we call them baseline radiographs. And that way we know what is the normal, not only for that species, but for that individual. So for Greedy, for a while, her normal was to have eggs. Eventually she needs to pass them, and she did, but these are what the eggs look like. So we get used to taking a lot of radiographs on every animal that pretty much has an exam.
And obviously this equipment, this new equipment, this digital equipment was probably more expensive in the upstart, but do you end up using less supplies because you're not using film?
A ton less supplies, because we're not using the film. There's 3 different solutions that go into dipping radiographs, and those are also bad for the environment. So there's a lot less chemicals going into the environment with the new digital system.
Great.
As well.
We always want to do the best that we can for the environment, because that's the best we can do for our animal friends too. So have there ever been any, well, let me back up. So Greedy's passed the eggs, so she gets a clean bill of turtle health.
Yes.
And she can go back to the education department and we won't worry about eggs, which we were pretty sure she had passed them anyway. But do you guys have any favorites that you've taken that you'd like to show us?
Radiographs, we do have a few favorites. We can start with Brittany's, I believe. It's up here. No, trying to be fancy. So that right off the bat, one would think that that is some sort of long-billed bird, but that's actually a mammal that is a giant anteater. There's nothing wrong. This is Mateo, if anyone knows him. There's nothing wrong with him. We just wanted to get a normal baseline of what an anteater nose looks like. And that's it. And it looks pretty cool. That's one of our favorites.
And I don't know if the viewers on Facebook can see it, but if you look at the very end, you can see the very tip of his little tongue sticking out.
Little anteater tongue. So this is Dyson, our resident chinchilla. You can tell he's a rodent. He's got these teeth and these really, really big, long ears. One might think that it's a rabbit, but it is a chinchilla. Also, he's just getting a baseline check when he was anesthetized for a full exam, and he looks good.
He always looks good. He's so adorable.
This is a cockatoo. So this is a pretty typical radiograph for a cockatoo. It looks actually really healthy and good. If you go over here, yeah, there we go. You can see right here there's this piece of metal that you would think that's in the cockatoo. That's actually a transponder or a microchip. So just like dogs and cats get microchipped, so do most of our birds, so we can individually identify them. This is a green mamba. If you notice, there's a line on either side of them. That is for the safety of the staff, as well as it keeps the snake straight for a better picture, because if he coils into a ball, it's very hard to do any actual sort of diagnostic evaluation on him.
And we actually did one of the very first Facebook Lives. Michelle and John Roll did a great job tubing a snake so that everybody could see what that procedure was. So you can go back and look at that video if you want to see how that's done. But I'd also, if you don't mind, I'd like you to point out the snake's ribs. People don't realize how many bones a snake actually has. They have a lot.
I don't know if you can see the pointer, but there. So all of these are the ribs, and like us, the ribs run along our thoracic cavity, and so they cover our lungs, and so all of this black is actually the snake's lung as well. And if you go all the way down here, this is the snake's heart right there. Guam kingfisher. He's a little rotund in this picture. He's well fed. That's a tarantula, so we weren't actually doing much for diagnostics other than we were curious to see what a tarantula would look like under a radiograph, and it's actually quite boring. Here we have a bullfrog. All of this mineral that you see in there, frogs like to eat dirt and whatnot, so that's what's showing up there. That's all completely normal. Another tortoise. This is actually Capulet. She's one of our zebras. We recently did an exam on her because she had some nasal discharge, and we wanted to make sure that she wasn't having any sort of nasal infection. So we were able to get radiographs of her head when we were doing an exam on her. It looks like she's got a little bit of dental disease, but otherwise her sinuses look great. And if any of you guys own horses, you worry about guttural pouch disease, which is another disease of the sinuses, and she does not have that either, so she looks pretty good. However, Capulet is very old. She's in her 20s, and she does have some signs of arthritis. So right here, you can see there's a big bump on the bone, and if you go to this radiograph over here, that's normal bone. So she has some arthritis that we are going to closely monitor and manage with medications.
Did we know about the arthritis before the radiograph?
We did know about the arthritis from her exam a few years ago, so basically it's a monitoring process to see how it's progressing. And then we're back to that one.
All right, guys. Well, we really appreciate you taking your time today to show us how some of the tests that we can run on the animals, so that we're not being invasive when we don't have to be, and that can determine if we need to do something more in the course of care. So everybody, we'd like to thank you for watching, and remember, even though we're closed, we're still caring.